Welcome to Part 6 in this series. This section will include information about Medicare programs for people with limited income, tips to help you protect yourself and prevent fraud, and will conclude with a review of a list of available resources. Many people with Medicare face challenges when it comes to paying for health care and prescription medications. In fact, we often hear of people who must choose between paying for groceries or paying for health care or medicine. If you know of anyone in this situation, please let them know about some of these important Medicare programs that can help. The following programs may be of assistance to people who have limited incomes. Medicare savings programs provide help from the state for people with limited income and resources. If eligible, your Medicare Part B premium will be paid for you. Some people also have their Medicare copays and deductibles paid as well, based on their income and assets. Extra Help is a Medicare program designed for people with limited income and resources to help pay for their Medicare prescription drug costs. People who qualify will get help paying their Part D plan's premiums, deductibles, and copays based on their income and assets. They will also have no coverage gap and no late enrollment penalties. Each financial assistance program has different eligibility requirements. Click the links or call the numbers provided to learn if you can get help from these programs. When you file an application for Extra Help, you can also initiate an application for the Medicare Savings Program. Idaho Department of Health and Welfare will contact you to help you finish the application. You must have a Medicare prescription drug plan to use Extra Help. If you are not yet enrolled in a drug plan, you can apply for and use Extra Help to obtain prescriptions right away. The Humana Linet program will be your temporary coverage until your Medicare drug plan starts. You or your pharmacy can call Linet at 1-800-783-1307 for coverage information, or you may call Sheba for information at 1-800-247-4422. Protect your retirement, protect yourself, and prevent fraud. Medicare fraud and abuse happens, but there are a few important things that you can do to prevent it and to protect yourself. Protect yourself and others from Medicare fraud. Don't give out your Medicare number except to your doctor and other Medicare providers. Do treat your Medicare card like a credit card. Watch out for identity theft. Be aware that Medicare doesn't call or visit to sell you anything. Be cautious of any offers for free medical services. Remember, if something sounds too good to be true, it probably is. The Idaho Department of Insurance recommends 1. Screen your phone calls. If anyone calls you who you did not have a scheduled appointment with and requests personal or private information, hang up. 2. Be wary of advertisements. Be cautious of changing your insurance plan based on any advertisement. Any extra benefits and Medicare insurance ads on television or in mailings might not be available where you live. Get all the details in writing before you sign up. 3. Ensure the plan is right for you. Before you sign up, reach out to your doctors to verify that they are in the plan's network and check to see if your prescriptions are covered. 4. You do not need both a Medigap and a Medicare Advantage plan. Even if someone promises that you can keep your Medigap plan and have a Medicare Advantage plan, it is against the rules and it is not beneficial to have both. And do pass it on. Share these do's and don'ts with friends and family. If you sign up for a mymedicare.gov account, you will be able to access your personal Medicare information online. You are also encouraged to keep a personal health care journal where you can keep track of your doctor visits and services. Take it with you to your appointments. Then you can compare your Medicare summary notice to your journal. Always review your Medicare summary notice. The Medicare summary notice, or MSN, is sent quarterly to people with Medicare. Be sure to review it when you receive it. It's not a bill. Check the name, address, and Medicare number for accuracy. Ask, did you receive each service? Again, compare it to your healthcare journal. Be sure your claim is processed and paid. If an item is denied, call your doctor's office to make sure the claim was coded properly. If not, the doctor's office can resubmit the claim. If the claim is denied, you have appeal rights. The deadline to appeal is 120 days. Report any suspected Medicare fraud or abuse. If you notice something that doesn't seem right on your bill, the first thing to do is call the provider to discuss your concerns. Be sure to gather your documentation, such as your personal healthcare journal, billing statements, and your Medicare summary notice. And if the issue isn't resolved, call Idaho SHIBA toll-free at 1-800-247-4422. We've covered a lot of information during this 6-part series, so before we end, let's do a quick review of the coverage options you've learned about. Remember, there are 2 ways to get your Medicare coverage. Option 1, Original Medicare, or Option 2, Medicare Advantage plans. On the left, Option 1 is Original Medicare including Part A and/or B, and you can add additional coverage such as a Medigap policy to fill in the gaps of Original Medicare. You can also choose to buy a Medicare prescription drug plan or Part D. Or you can choose, on the right, Option 2 to get your coverage through a Medicare Advantage plan, which will cover Part A and B services and supplies and usually includes Part D. You may be able to add drug coverage to some types of Advantage plans if it's not already included. This concludes the Welcome to Medicare series. This presentation was brought to you by the Idaho Senior Health Insurance Program, or SHIP, a local public service that provides free, unbiased help for people with Medicare. If you have questions about Medicare, call us at 1-800-247-4422 or follow the link to Idaho SHIBA website to find local, unbiased Medicare help near you. You don't have to go it alone. Thank you.